Hi, this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for Better Business, Better Health. I'm here with Yair Brosh. He is the CEO and founder of Donsi.
Donsi Health.
Donsi Health. Tell us, what is Donsi Health and what is it that you're doing?
So Donsi Health is using a unique infrared technology to identify different bioindicators remotely. More significant one is pulmonary congestion at home, at your home environment.
So there's a little bit of underservice when he says that. When he says an assessment of that, let's show you. You can see this is a remote device, so it sits on a table. This is something that people can put in their home. And interestingly, you're doing this how? What's the technology behind this?
So the technology is measuring infrared signals and detecting the deviation based on the movement. Then once we have the movement, we convert that into acoustic sounds, and then we apply our signal processing analytics on top of those acoustic sounds, allowing us to provide very accurate signals. Basically, everything a physician could listen to, our device could listen in a very high accuracy.
So listening with imaging using infrared remotely, and tell us what variables have you managed to achieve to date?
So to date, we have 3 generations of devices. Our first generation was FDA approved with heart rate and respiratory rate. We already submitted AFib as a pre-submission, so our first ones were a de novo. We wanted to make sure that the next one would be a 510K.
Right.
So AFib was already recognized by FDA as eligible for a 510K submission, and we're pursuing that. And we have pulmonary congestion coming soon.
Wow, pulmonary congestion from a remote sensor that doesn't even have to touch somebody. This is based on imaging. And the first generation device that we just looked at, that sits on the table, but you actually have an auto gimbal that will locate and do that automatically.
Yeah, so we have our 3rd generation device. We can see it actually on the screen right now, and the idea is that it would locate you. And the next one after that would be remotely above your TV or embedded within, able to capture a wide area up to 5 meters and taking the same measurements.
So broad remote patient monitoring at the patient's home or in the medical home. You're essentially giving physicians insight into clinical variables. So you said respiratory rate and heart rate accurately, and you've got atrial fibrillation and pulmonary congestion on the way, and you have FDA approval for the first 2.
Yeah, and interbeat interval. Okay.
That's fantastic. So this is really exciting. Obviously, newfound technology. Where do you see this going? What's the opportunity for you?
So currently we're pursuing congested heart failure patient.
Right.
The numbers are, as you know, readmissions are huge. That would be the first one. The second one would, so just think about it. There are about 1 million people that are being released from hospital. 200,000 of them would come back within a month, 500,000 within 6 months. So if we can deliver those devices and pinpoint the 200 ones that are about to be readmitted and just give them diuretics and delay this readmission and treat them in the meantime, that's a huge thing. Next step would be all the patients with very low ejection fraction, or NIA 3 and 4 that weren't hospitalized. So you look at a huge market of people that are about to be hospitalized, and we can really improve their quality of life and sometimes save lives.
And to be clear, this is a device that the patient can use, because you showed me before we got on the camera, you actually did this essentially as a patient. Scan a QR code, register, get set up, and then
that's it.
It read you, and we
drink your coffee. You don't need to undress. You don't need to put any wires, any patches. Just sit in front of it, drink your tea, coffee, do your social media stuff, read your newspaper, whatever you choose, and it will be your safety network.
That's fantastic. So historically, what were we doing with congestive heart failure? We're putting people on weighing scales, not a very granular thing. Now we've got really granular, and this whole on-ramp to real capabilities of clinical insights to really explode this telehealth space. Very exciting. Looking forward to seeing where this is going. Thanks for joining me on the show today.
Thank you very much. Pleasure.
This is Dr. Nick. I'm the Incrementalist, here with Incremental Insights for better business, better health.